Welcome everyone to our AIM Big meeting tonight. And as everyone knows, I believe Karen Grund is here, and she's going to talk to us about the National Falls Prevention Study. What exactly is it, Karen?
Well, that's how I was going to start out. Should I jump into it?
Yeah, go right ahead.
Okay. Um, it is called the Falls Free 2015 National Falls Prevention Action Plan. That is written by the National Falls Prevention Resource Center, which is an initiative of the National Council on Aging. They did their first presentation back in 2005, but I'm getting ahead of myself here. Let me tell you who these people are. The National Council on Aging is, I'm just reading. Basically, what I'm going to be doing is reading to you most of the time, although there's a lot of opinions that I'm going to express as well, because I feel strongly about some of this stuff. And that's why I wanted to talk to everybody. Please, if you have questions or comments, just unmute yourself and talk. I would like the feedback because I'm sitting in my bedroom just talking to myself. That's how I feel like I'm crazy. So join in if you can verbally. But I'm going to be reading to you a lot of well, I'll start reading it right now. The National Council on Aging, NCOA, is a respected national leader and trusted partner to help people age 60 plus meet the challenges of aging. Our mission is to improve the lives of millions of older adults, especially those who are struggling. Through innovative community programs and services, online help, and advocacy, NCOA is partnering with nonprofit organizations, government, and business to improve the health and economic security of 10 million older adults by 2020. And then you go to their site, ncoa.org, for more information, which is where I got most of this stuff that I'm going to be presenting. The Falls Free Initiative, which is the topic of this conversation, is a national effort led by NCOA to address the growing public health issue of falls and fall-related injuries and deaths in older adults. I don't know if you guys know this yet, but 1 out of 3 seniors fall every year. That's
1 out of
33%.
3? Is that what you said?
Yeah.
Is there
I'm sorry?
is there any feedback as far as how many people actually get hurt when they fall?
Yeah. 8, let me see. 1 out of 3 get hurt, and 8 of those are fall. 1 out of 3 fall, and 8 out every 8th one either hits their head or fractures their pelvis,
Wow, that's huge.
which are, yeah, real bad injuries, especially if you're on Coumadin or something, some blood thinner, because you'll bleed to death real quick that way. And of course, what's worse than that is a head injury or a pelvic fracture that you have to live with, which is painful and disorienting. Your life is completely turned upside down. So, and it's extraordinarily expensive. A lot of rehab is involved in that. Yeah, you got it. That's it right there.
Good.
So, there are some doomsday prophets who believe, because of the baby boomers right now are between the ages of 52 and 70. They're defined as people who were born between 1946 and 1964. So there are people who believe that so many of them are going to fall and go and become hospitalized and need extra health care that they'll actually cripple the economy because it's just so expensive, and it's preventable. They don't need to fall and hurt themselves. Falling is not an issue of age. It's everything decreases as you get older, but you don't falls are not natural to people who are older any more than it is for a 9-year-old. They fall for reasons. There's always reasons. Now I forgot where I was. All right. Well, we'll go on. I wanted to give you a little background. In 2005 is when they had their first summit. Okay, so there was a booklet that looked just like this that said 2005, where they had an action plan then. For some reason, they waited 10 years to have their second action plan, which was, or second summit that created the second action plan. And that was last year, 2015. And at that summit, they decided that they would have one 3 years later. So that would be 15, 16, 17, 18, 2018, which is like almost 2 years away.
Wow.
So that was another reason, is because baby boomers in 20 years will be 72 and 90 years old. So by that time, they're they'll be fragile. They'll be starting to get fragile, the most elderly of them. So the crisis, if there's going to be an economic crisis or what have you, will be almost there or over. So yeah. So the 2 or 3 years, however long it takes for them to put this action plan into effect, I'm sure they can't do it fast enough. And I don't know. Maybe we want to be a part of it. I think I want to be. We'll see. We'll talk about it. So after the first fall summit in 2005 and 2006, they had legislation that said that falls prevention stuff should be evidence-based. In 2007, they had 3 interventions that were evidence-based. One's called A Matter of Balance. One's called Stepping On, which was an Australian occupational therapist who developed that one. And the third is Tai Chi. Tai Chi is really big for fall
Wow.
prevention. Yeah. Also in 2007, the NCOA met with the World Health Organization in Canada, and I'm sure there were a lot of other people who were there too, a lot of other organizations. And it's a global problem. It's not just our elderly that fall. It's a problem worldwide for probably almost exactly the same reasons. Um, in 2009, the American Occupational Therapy Association wrote something that called, and they had a contract between them and I think it was the CDC, Center for Disease Control, although I could be wrong about that. But anyway, it was called Improve the Public Policy Response on Older Adult Fall Prevention. I looked that up today, and they did a real nice job. They looked at the situation as it was, the issue of falls and how expensive it is, and I forgot to mention, a fall means that you're going to go to the emergency room, then you're probably going to be hospitalized, and then you're going to get rehab, and by the time you're done, it's $35,000. That's the average cost of a fall. So it's expensive and preventable, and it's cheaper to prevent than it is, obviously, most things are, for it to happen. So anyway, the AOTA made a real nice document where they looked at it as if they were the government, and what they would do to change different policies, and they made real good recommendations there. In 2010,
So, Karen, can I interrupt you for 1 minute? I'm sorry, and I must have missed
of
it.
course,
So, excuse me. So, AOTA was a part of this summit, the National
they were
Falls Prevention Action Plan?
they apparently have been pretty active all along with it. It's unfortunately, I did speak to Karen Smith, and because of her, she's leaving her position. I didn't find out where she was going. I didn't want to be nosy, but I wished her well. And she will ask, if you guys have questions for her, I told her I will get back to her and address them, with her, so that everybody knows, gets their questions answered. She was there at the summit in 2015. I don't know if she was in this position that she's in now. Back in 2005, maybe she was, but she was it wasn't, I thought she was a co-presenter, but they didn't call it that. Facilitator, something,
Nice,
whatever it was. She was
nice. Yeah, I just want to make sure. It's always
with a
important for us
workshop.
to be a part. Yeah.
I'm sorry?
I'm just glad that there was an OT involved in this.
Yes, yes. Okay, in 2010, the Affordable Care Act passed, and the codes, they were called PQRSs back then, where they coded for Medicare stuff. Um, they added codes for fall risks and for the plan of care to address that.
Wow.
So, 2011, they had two new things. It's called Steady, which is a toolkit for doctors to address falls, like while you're doing your annual physical, and something called OTAGO, OTAGO, which is an exercise program developed for physical therapists. It's developed by physical therapists, and only a physical therapist can do it.
Nice.
So, yeah, so that happened in 2011. In 2012, Congress requires Older Americans Act Title 3D funding to be evidence-based. You're going to hear a lot of evidence-based. They're really, well, you can't blame them. There's a lot of money involved. It's a very serious issue, and whatever efforts they want to go into it, they want to make sure are going to work. So there's evidence-based everything all throughout there, which is where OTs really have to step up to the plate, I think, a little bit here. But maybe I'm wrong. Maybe we have more evidence than I think. Um, in 2013, the Center for Disease Control and the American Physical Therapy Association convened to promote fall prevention in practice. And I don't exactly know what in practice means there. If it means in the clinic, I don't know. But that was one of the things listed that I thought was interesting because AOTA didn't do that. They did the paper, but they didn't do this, whatever this other thing was. Another thing that happened, and this is real interesting, in 2013 was the National Institute on Aging, which is, I think it's a division of the National Institute for Health. These are both government agencies. Um, they, they, or let me see, the Patient-Centered Outcomes Research Institute, PCORI. The two of them got together and formed something called the Falls Injury Prevention Partnership to support major intervention study aimed at preventing injuries from falls in older adults. That was 2013. Now in 2014, the PCORI and the National Institute for Health received 30 million, that's 30, it's a grant to research Brigham and Williams Hospital, Harvard Medical School, Yale School of Medicine, and UCLA to test individually tailored interventions to prevent fall-related injuries at 10 clinic sites across the country. So
That is huge.
there's big money in here, and they're real serious about the evidence-based practice stuff. And if we don't have evidence to support what we do, um, we're not going to be recognized.
Exactly. Hey, what page are you on?
This is way at the back.
Oh, okay.
I
Um,
kind of need. I'm explaining to you the way that I like to hear it. Is I like to hear like the whole history first
uh-huh.
before I get down to it's 44. I don't know why that number sticks in my mind. You just had 51, I think,
Okay.
and I'm leaving some of it out.
Yeah, I just thought
I'm
it'd
just
be
giving
fun to
highlights
follow along.
that was of interest to me. Let's put it that way. You'll see the years on the left. If you scroll through just flip the pages, the years that I'm talking about. I'm almost at the end where I'm up to 2014 now,
Okay.
and 2015 was last year. Um, so also another thing that happened in 2014 was that the Administration for Community Living and the U.S. Administration on Aging awarded a grant for the first, and this was official, that the National Falls Prevention Resource Center that NCOA has is like the national clearinghouse. It's the main place where they want everybody to go to look for information, both people who practice and for seniors who are interested in looking it up for themselves. And then we come to 2015, which we just left. They had the summit, and it says a White House conference on aging event. I don't know if this, I never asked Karen Smith if this happened in the White House. That would have been pretty exciting. I would have loved to go to that. But they also did, they published, this was the third edition, they've been doing something called a compendium, which tells you about all the specific interventions. Now, the interventions that are, it only includes evidence-based interventions. So they explain how they look at all of the studies that they have available to them, and they only picked out the ones that they have to be they're very strict about it. They have to be random controlled studies, random controlled trials, whatever you call them. And of course, they have to be a certain percent of effective in order for it to qualify. So it's still the ones that I've listed, the PT one, the Otega one, the stepping on, Tai Chi, and a matter of balance. Although there are more now that I think about it. I think there are more interventions than that in 2015. But those, of course, are still on there. So anyway, that's the history of this organization and what they've been doing for the past 10 years or so. And this action plan was just written last year. In 2018, they're going to review it and see how much got done, I guess, and where they were going to go from there. And that's what I'm getting ready to talk about next. Does anybody have any questions? Am I going too fast? Can you understand me? Is there anybody out there? It says 22 attendees, and I don't see any chats, and I don't hear any voices. Nobody has any questions? Say something. So, you know, I'm actually very tense about this. It would help if somebody said something encouraging.
It
Doing
sounds
great.
sounds like there's a
Okay.
lot going on with this.
What kind of OTs don't know how to encourage? Come on. Oh, I'm so
You go, girl.
disappointed.
It sounds really good. I want to find where you're at so we can follow along. So if you don't mind telling me the
All
page.
right, I'm going to start right at the beginning now. So, goal, wait a second. Okay, there you go.
Goal A?
Okay, I don't know what they call this. Point number A, physical mobility.
Got it.
There's actually 4 points, A, B, C, and D. There's physical mobility, there's medication management, there's home safety, and there's environmental safety in the community. So those are the 4 main things that they thought were important to address at this summit.
They're typing. Somebody just wrote, "Good job, very interesting."
Okay.
Yes.
I hope that doesn't mean you're leaving, Carl.
Nope.
Okay.
And Bahar writes, falls are the leading cause of emergency room visits among seniors. 1 out of 3 over 65 fall every year.
Yes. Yes. Yeah, it's real serious. And the interesting thing is they don't want to talk about it. And there was a real nice document I found about that I'm sure Karen you would be interested in, because it talked about like how to market and how to approach them. Words that exercise is one of those nasty words that we were making a list of 30 words. Exercise is one of them.
Wow, who knew?
Okay, so we have four letters, A, B, C, and D: physical mobility, medical management, home safety, and environmental safety in the community. Now, medical management, I know we do stuff with medicine to help them so they don't get confused and take pills twice and stuff, but there was nothing in medical management that I felt was of interest, so I'm not going to touch that. With physical mobility, there's goals A and B. Yes, see goal A right there?
Yep, got it.
So there's goal A and B for physical mobility. There's goal A and B for home safety, and there's goal A and B for environmental. The most interesting ones are the physical mobility, and I'm going to go over that now. But obviously the biggest share of stuff that would interest us would be in home safety. Although the environmental stuff, I mean, now you're talking about public spaces, that gets pretty exciting too.
Hmm, yeah.
But that might be some time for the future. That one. Um, so the physical mobility goal A is for, as you can read right there, all older adults will have knowledge of and access to effective programs and services that preserve or improve their physical mobility and lower the risk for falls. Now, the first strategy is to shift, and we talked about this, public education messaging to a positive, healthy living wellness message. We're not going to talk about fall prevention. That's a dirty word. So they put on to that you need to have, you need to talk about wellness, active living, energetic lifestyle. You don't want to talk about falls. They don't want to talk about that. So all the messages have to be positive like that.
And that's something that I'm going to really try to keep track of this because I would assume that they put some marketing dollars into figuring out, how to set what kind of message they want. So,
Well, what they did,
even go ahead.
Louis, were you saying something?
Oops.
Okay. Um, what they did at the last summit was they kind of gave homework assignments, and there was grants. There were grants that went out, which I didn't go through when I went through the synopsis. There was money. First, there was a small amount of states, then there was a larger amount of states, then there was even more states. So obviously, when somebody gives you grant money to do something, you have to report back on how it went. So part of what they did I don't know if if they did that in the second summit or if they did it earlier than that, probably earlier than that, because right after they were done with spending the grant money, they would have to give a report back or something. They, looked over what went well, what didn't go well, what problems were, and that was some of the responses that they were getting from the states was that you just couldn't call it fall prevention or nobody would come. It's I'll try. I know you would be very interested in that other document. I wish I could remember what it's. I didn't write it down. I'm sorry, but I'll find it for you and I'll make sure you get it. It's a lot of
Yeah, if you could
what
share
you're
it.
interested in as far as the marketing stuff.
Perfect.
How to, what are their concerns, what they do want to talk about, what they don't want to talk about, what their focus is, what their mindset is, and possibly how to change it. Okay. So strategy one is to shift the public perception, and the only thing about physical mobility, there's four strategies altogether under goal A, but strategy one was the one that bothered me a little bit because in shifting the educational message to a positive, healthy lifestyle, some of the action steps included the STEADY Toolkit and healthypeople.gov, National Institute for Health, Go for Life physical activity and exercise campaign, and Tai Chi. And then there was also something called the National Physical Activity Plan, which is a coalition of national organizations, including in part, and you'll scroll down there someplace. There it is, 11. Nope, not 11. Oh, maybe I clicked on that blue thing to find out more about it. Because I wanted to know who was included in this plan, whatever it is. Well, American Cancer Society is part of it, American American Heart Association, American Physical Therapy Association, American Medical Association, the Center for Disease Control, the U.S. Department of Agriculture, the U.S. Department of Health and Human Services, the YMCA, no AOTA. And I wish I had asked Karen, like, what's up with that? Why wouldn't we want to be a part of that?
Yeah, we
But
should have been.
hello?
And I just said we should have been a part of that.
I thought so. And I mean, if should I take notes to talk to Karen or send her a note?
Yeah, well, yeah, what
Karen?
can we do to get more involved in it? Is my question. OT in general, and I mean, how many OTs? Has anybody else heard of this plan before? I mean, I never heard about it, Karen, until you brought it up.
Yeah, the only reason why I found it was because I was, I retired for 2 years. I've kind of been doing things here and there, and I'm like, I really like working with seniors. I think I want to do something to help them with it, especially when I found out how terrible falls. I mean, I knew how terrible falls are. I treated them. They're awful. It changes their life if they get, they get the right fall in the right way. Their whole life is upside down. It completely changes and for the rest of their lives. They don't recover from it. They lose their independence,
Yep.
and it's painful. A hip fracture is really painful. So I was like, oh, well, this is a good thing for me to do. I feel very passionate about it. And then I found this, and I was like, oh, this is more than just interesting.
Yeah.
So I'm gonna. So I don't like any of you attendees. There's 22 people out there, and Karen's the only one who's talking to me.
All right, you guys, you gotta talk
Yeah.
too.
All right. I'm gonna write down. Are you gonna
I
type it
keep
down
getting
for me,
kicked
Karen?
off.
I'm sorry.
I said I keep getting muted by my computer. I'm not sure what's going on. But
Oh,
I'm putting information in the chat, if that helps.
okay. Um,
And I have it.
This is Louie.
Yeah. You want to tell her what you were chatting about?
yeah.
Yeah, I part. I guess I've been working with the North Carolina Falls Prevention Coalition, and they
Okay.
asked me to do a presentation on the influence of home modifications on fall prevention, because a
Okay.
lot of them didn't really understand, you know, we hear about it but don't know much about it. So I put together a PowerPoint. It's not prettied up yet, but I got the bones in it.
Okay.
And so I sent a copy to you, Karen, and to Nancy, and I'd love to send it to you, Karen. I sent
Sure.
one to Nancy and to Karen.
Yeah, can you
Anyway,
resend it to me and I'll send it out with the next email?
yeah, I sent it to you.
Can you resend it though?
Yeah, I can.
Thank you.
But it was interesting that because I went to the CDC. Um, let's see, I've looked at so much research here lately. It's like
Yeah, that's
it's
a
all in
lot.
one. It gets all messed up in your head. But
It sure does.
anyway, the CDC put together this, I guess, this catalog more or less of all the different research studies that have been done on falls prevention with exercise, medication studies, home modifications, and stuff like that. And so it was a very interesting research project to go through, and it helped me understand a little more, and I felt like I could, definitely say something to the Falls Prevention Coalition here in North Carolina that, there is um, good evidence for home modifications, and it's really more or less a multifaceted approach with the home assessment was very important that an occupational therapist provides, and there's been studies comparing both the assessments from non-OTs and OTs and the results uh, from those studies, and also so it more or less studied the assessments, the modifications, and the exercise programs, and that without all three, it was not as successful for preventing falls.
Wow.
So
Yeah,
I
I
was
found the same
excited to
thing.
hear that.
Yeah. Study after study shows that there's not just one um, plan of attack. to help prevent falls. It has to be multifaceted.
Yes.
And I even read just today, I was reading a study that said regarding home modification in particular, that it was about, they were following up a year later after the recommendation. The OT would just went in, recommended grab bars, whatever.
Hmm.
And then she had somebody else call a year later and ask, how that was going, if they did, took the recommendations and if they were using them. And half of them did not. And
Yep.
the reason was because they didn't think it would prevent them from falling. It wouldn't help.
Wow.
Hmm.
Yeah.
That's one of the things that they did say is that, you couldn't just say, do this and then walk away. It
No,
required a
no.
lot of follow-up.
Yes. Yes.
Because a lot of times people, they say, oh, that's going to cost a lot and I'm not going to do it next week, and then they forget about it. But, that's where having the follow-up and the connections to people who, handymen or contractors, this, that, what other, to make it a little more less daunting for the homeowner or the patient might be a good thing.
Yeah. Yeah. Louis, were you the one that was doing the Meals on Wheels, or was it somebody else?
I think it was somebody else. I have done Meals on Wheels.
Yeah, it's Margie.
Yes.
I was the one, and my meeting got postponed, so it's coming up. So I'll let you know how that goes.
Okay, I just wanted to tell you that that strategy was supposed to be a good one to get you into the home and making remarks. I don't think they would walk you around your whole home, but it's a good strategy to get the seniors listening to again, you don't want to call it falls prevention, but how they can be more comfortable and safe in their own homes.
Mhm.
Yeah, they had a whole list of them, going to senior centers, most of the kind of obvious ones you would think of already, but they specifically mentioned Meals on Wheels.
Yes.
And that is a good program to alert people too, where there's
Yes.
is a problem.
Well, and
Yeah,
it,
I was.
go ahead.
Oh no, I was just gonna say I was running it and looking at the whole Meals on Wheels thing, and my local government. I've just run into so many obstacles. Like it's not as cut and dry. There's the fall prevention is like sort of subcontract. It's not through the government, through the county government. It's they hire some outside company to do the fall prevention. It's not all streamlined. They have like I said, this third party that goes out and does fall prevention, but only if a case manager recommends that someone come into the home. That means the client getting Meals on Meals has to have a case manager. So it's not very streamlined, at least where
Yeah.
I am.
No, you're right. I think that's the reason why the National Council on Aging started doing this, was because somebody had to start giving direction, because it's so multifaceted. There's so many things that prove helpful, and one thing doesn't take 75% of the load. You have to play with it. A little education, a little physical activity, and the physical activity has to be balance as well as strength and coordination. It also has vision is a big part of it. You have to go to your eye doctor and you have to get the
Hmm.
prescription filled.
Yeah.
Um, so, and so there's a lot of stuff that goes. It's a good thing that there's a national organization that's organizing this, but I really think that OTs need to have a stronger presence with them.
Yeah, me too.
And
Definitely.
Hey, Karen, let me read a little bit of the comments. Mahar writes, Tai Chi is well-supported research intervention that decreases falls among older adults. And he also wrote there are 400 causes of falls. Anytime an individual is on 4 medications or more, they're deemed to be at risk of falls. I never knew that.
yeah,
Yeah.
yeah, that's another prong of the attack, is to. And I disagree with talking to your doctor about it. I'd feel better talking to my pharmacist about it, because I feel like they know more about drug interactions than the doctors do. But drug interactions and keeping the doses as low as, and they have to be effective, but, just effective. You don't want to because you get side effects.
Yeah, yeah.
Yeah, there's a nice little list of things that all contribute. And again, the issue with the Coumadin, you really have to be careful, or any blood thinners. You especially have to be careful because once you start bleeding, it's trouble.
Yeah.
Was there any other remarks?
Yeah, actually, Yulriki, I don't know if I pronounced your name right, said that during National Falls Prevention Month, he gave a seminar at a retirement home focusing on preventing falls at home. And Louie said she did as well. And it sounds like quite a few people have done quite a bit with this. Cosmo writes there's a systematic review of the effect of home modification and fall prevention programs on falls performance of community dwelling older adults done that was published in AJET in 2012.
That's correct.
If you have a copy of that study, that would be wonderful, Cosmo. If you could send it my way, I'll distribute it to everyone. And then Cosmo also writes a mix of exercise and education, home modifications, and assistive technology is the best evidence. Oh.
I'm trying to do presentations in the community, and every place I approach, they take one look at me and tell me to leave. How are you guys getting to do this? Do you like pay them?
Senior centers love volunteers.
Well, I am volunteering. They still don't want it. It's very frustrating to me.
You need to go about 2-3 months ahead of time because they make their calendars up 2 months ahead of time.
Oh, you have to be patient. There's the problem.
Yeah. That's what I found is that, when I read that the Falls Prevention Month was in September, or Falls Prevention Day was September, I went to the senior center locally and in, I think, July, and said, I'd love to do a presentation. And so that worked out well because they were doing the Matter of Balance program too. And part of that program is to have an outside, I don't want to say expert, but a presentation from someone on the outside who is qualified to speak about falls prevention. And so I put together a presentation for them and gave it.
Okay. Okay.
Right, she wrote, she did a fall prevention at a senior village. She said she called and offered it in advance. But maybe you have to word it as they were saying earlier, where you have to say something like healthy wellness, safety, or something like that.
Yeah.
Physical
Yeah.
mobility.
Yeah, when I say fall prevention, it looks like I want to come and measure everybody for a casket. I mean, that's the look I get.
That's a good way to put it, too. That's a really good way to put it. Nina, when you...
Okay, any other remarks, or should I continue?
Oh, let me just ask Nina something. When you did the fall prevention, did you tell them it was fall prevention? Did you use those words? I don't know. Huh. Yeah, I'm wondering, what kind of words people are using when they go in.
Yeah, you really have to dance around it. You have to be, so careful that it might, oh, I didn't mean that.
Yeah.
Well, I did say falls prevention because, like I said, I was looking at the AOTA website and, some of their, I guess.
Yeah, they have a PowerPoint and they call it fall prevention.
Yeah. And like I said, I went to the senior center because I know they're always looking for programs. And
I thought that too, but I never thought to be patient about it. I'll give it 3 months.
That's it.
It might just be who you talk to as well.
Make sure you talk with whoever's putting together the program.
Oh, yeah, I might not have hit the key person too. That's a good point.
Yeah. And another thing that you might want to try that I did a home fit presentation for is I want to say the home health for the home aides through the community health department. And I did an in-service, and they really appreciated that too.
Oh.
Yeah, one of these initiatives, and I didn't highlight it because it doesn't really impact us that much, but one of the initiatives was to train providers, direct care people, physicians. I mean, everybody doesn't, they're not as aware of the uh, the fall issue as really they should be. It's a big, doctors, they want doctors to ask, just ask, have you fallen last year? Did you hurt yourself? Those two questions they want them to ask.
But one issue I found with my mom is she was having problems where she was falling quite a bit, and she was really trying to make sure nobody knew about it.
Yeah, and I gotta get you that document, Karen. I have to write down. I have to find it so I remember what the name of it. But that was one of the issues. Is they have a lot of emotions that are tied to falls. They're embarrassed. They are ashamed. They don't want anybody to know. They don't want to talk about it. Um, and that's when they did fall already. Um, and one of the things that they found with the fall prevention classes was that they're a little more ready to listen to the problem, to how to address the problem after they've had it, which is, I want to hit them before they fall,
Yeah,
so
yeah.
that because it's when you fall, it's luck of the draw. If you hit the right spot on your hip, anybody's going to break their pelvis, even if you don't have osteoporosis. So or hit your head. You really don't want to hit your head.
But even if your gait is off, something like that, that can cause you to fall. If
Yeah.
your
I had,
balance
yeah,
went
I
off,
had
that,
one teacher said that a stumble counts as a fall for occupational therapy. I've only had one teacher say that, and I was in CODA school and an OTR school, so that's like 6 years of schooling.
Wow.
But only one teacher said a stumble counts as a fall, and I was like, "Excuse me, not really. You don't hit the ground." And a fall is defined as unintentionally coming to rest on the ground.
that's
But
right.
she counted a stumble as a fall because stumbles happen 2 or 3 times before you actually fall, probably.
Hmm.
Oh,
Yeah.
Okay,
Is there,
so
is there,
we should go on to home assessments, home
sure.
safety, rather. Yeah, I didn't see anything in there that particularly struck my eye. You could, yeah, that's the service providers one, where they want service providers to be more aware and their strategies for how they were going to
this is
enlighten.
interesting, though. Create a national web-based clearinghouse for health and wellness professionals and aging service providers that can provide credible information. That's kind of interesting.
Well, that's what they're doing. That's what the NCOA, the National Council on Aging, is doing, and that's what the summit was about. Um, Kind of, sort of. I mean, that is included in that. The
Nice.
National Falls Prevention Action Plan. Part of that plan is to use the National Falls Prevention Resource Center. They got funding for that, and there's a lot of, if you're interested, there's a lot of information there. About a lot of, I mean, home modification comes into it a lot because it's a different mindset, I guess, as an OT, because you can modify somebody's home because they had a spinal cord injury, and that's one way you're thinking about it, one line of clinical reasoning. But it's kind of another line to look at somebody who's relatively healthy and vigorous, and you're like, you are at risk for a fall. Maybe I ought to just stick this in. There's 3 tests that you can do. I made my husband do it just so I could tell you how long it takes. It takes 5 minutes. You set up a chair against the wall. You pace 10 feet away from it. It's called the timed up and go. You have the blue painter's tape in one pocket, your cell phone in the other. and you have them sit in the chair. You explain to them that they get up from the chair, they walk over to the painter's tape on the floor, which is 10 feet away from the chair, and then they go back and sit down in the chair again. And if they can do it in under 17 seconds, they're good. If it takes longer, they're at a fall risk. There's also a test called the chair stand. You stand up and sit. You put your arms across your chest so that your hands are on your opposite shoulders, and you get up and down from the chair as many times as you can in 30 seconds. And I forget the parameter for that, but again, if you can't do as many times as the number indicates, then you're not, you don't have enough strength and balance in your lower extremities, and you're at a fall risk. The third test is 5-stage balance, where you put your feet in different positions, 4 different positions, because there's 4 stages. And if you can do all the way up to the third successfully for, I think it's 15 seconds, holding your balance without falling over, obviously you guard the person so they don't really fall, then they're not a fall risk. If they can't do it, then they are a fall risk. My husband and I actually didn't pass that test, or my husband didn't. I know I can't. And the first thing he said to me was, no, I'm not. And I'm like, well, you didn't pass the test, honey.
Wow.
Well, that's the definition of a test. So he fits the senior profile just like all the seniors do. So it's those 3 tests. I did the 3 tests I got the chair, I put the thing down, I explained to him each test what to do. Even though he doesn't like listening to my instructions, he did them. And we were done. You use the stopwatch on your cell phone so that you can time it. And then you put everything back, and I swear it was 5 minutes to do it. So I think you're crazy if you do a home assessment without doing taking 5 minutes to do those 3 tests, just to tell them you need
Wow.
to look out. Well, I don't know how to tell them. Don't tell them they failed the falls test, but I don't know what you would say. Maybe
Wow.
you should be special careful while you're walking around. Maybe you should, I don't know, learn something.
Yeah, it'd be nice to know how they would want you to take it from there. Nancy wrote there's also something called the senior fitness test. And
I'm not familiar with that one. The timed up and go, the sit stand, chair sit, I forget what they call it, chair stand, whatever, that test, and the 4-stage balance test were the ones that I saw most frequently in the literature. And it's the one that's published as a result of this summit, they have another booklet that I'll show you if we have time at the end. Well, let me see, it's 10 minutes to 9 now. So if we have time, I'll tell you. I mean, I'll tell you anyway, but maybe we'll have a chance to go through it, and you can pull it up.
Nina also writes the Berg balance test is a good one.
Is
And
it quick?
the Berg balance test.
Yeah.
And also, I think this is interesting. Ulrich says that fall prevention is gaining interest from the media. He found a great series in the New York Times called Bracing for the Falls of an Aging Nation. That
Oh, I
sounds
love that title.
Yeah, it's a little scary, I think.
The whole thing is scary.
Yeah.
And the thing is, they don't react well to being scared. Scared, you can't. That's one thing that the article said too, is that you don't want to scare them because they run in the other direction.
Does it say what you're supposed to do with the findings from the tests? That's one thing, Margie. Thank you, Margie, for writing that.
Well, it indicates whether they're a fall risk or not. If they if they just give you a cutoff. So if you're over, if you're under the amount, because it's always, if it's faster, it means you're more steady. So if you're under the amount, it's better. Well, except for the balance test, you want to be over for that. And with the balance test, if you're up to the third stage, you're okay. If you can pass the third stage. And the fourth stage, they just kind of throw in there. But if you don't reach those parameters, then you're at a risk for fall. And obviously, if you can only pass like the first stage of the balance test, you're more of a risk than if you could do the first and second, but you had trouble with the third. It's just an indicator of how much of a risk of a fall you are, or the client that you're looking at.
Well, and Nancy says one strategy could be something like could be a large public health initiative with television messages geared towards the baby boom generation, with some safety suggestions, but with a positive spin. I think that
I missed the first part of that. What was this?
a strategy for
Television?
helping people. Yeah, one strategy could be television messages with.
How do people do that? How do you get on? I can't even get into a senior center. You want to get on television? God bless
No,
you.
but this Falls initiative has that.
Well, I think it's a great idea. I want to tell me. I'll watch it. Really?
Yeah.
I'm so impressed.
And then
All right, I'm going to move on to the I forget what they call it, the home safety one. I don't think they called it anything. I don't think they called it a goal topic, whatever it is. Home safety goal A. All older adults will have knowledge of and access to effective home safety measures, including information, assessments, and home modifications that reduce home hazards, improve independent functioning, and lower risk for falls. Now, there are three strategies regarding home safety. The first strategy is to raise awareness and dissemination of information about home safety practices and options for caregivers and older adults to reduce falls. The second strategy is to identify funding sources and community-based resources that assist older adults in accessing home assessments and making appropriate modifications. And the third one is to support consumer adoption of home modifications aimed at fall preventions by featuring examples that are attractive, appropriate for home settings, easy to implement, straightforward to use, and affordable and effective. So those are the three strategies towards the homes. And for each of these strategies, they have action steps. So we're going to go back to strategy number one because most of them I didn't really feel too strongly about one way or the other. But when they came to publishing a list of aging-friendly home builders and remodelers, now you're talking about a list that everybody's going to look at, and if we're not on it, I'm concerned.
Yeah.
So it says, publish a list of aging-friendly home builders and remodelers who have completed home. And here we go with a training, who have completed home safety home modification training. Now, Karen, where do you get this training? Who's the expert? There's 1,000 experts, right?
I think the OT should be.
Yep.
I think so too. But they mention the CAPS. And from what I've heard, I don't know anybody who's taken CAPS except for the people in this group. So, and I haven't heard that it's, wonderful. I've heard that the Southern California was better. Is that right?
Yeah, I thought
That's
so.
true.
I agree with you. And I didn't think CAPS was that helpful.
Mm-mm.
It's better
Yeah.
marketing.
So that had me a little concerned because they're making a list and they're mentioning an authority that we maybe don't even agree with.
Well, the other thing that bothers me is the list, according to number 5, is aging-friendly home builders and remodelers.
Yeah.
What do they know? What do they know about falls and how to prevent them?
Yeah, and who's making this list? And where are they going to put it on the National Council of Aging website so that everybody goes to it? And that's where they get because I mean that's you Google You Google and you pick the first one or two off the top of the list, and maybe you call and find out if you like whatever the service is that you want. Then you pick one. If you're not on that list, too bad for you.
Yeah, well, it looks like they're
Look for
just
another
looking for
job.
home builders and remodelers to protect people from falling. Where's the OT in this one? Why are OTs on this? I want to find out
I'm glad to hear
who's
that
charging
tone
this
in your
down.
voice.
We need
That's
to,
exactly how I felt when I read it.
well, who's the OT that's representing AOTA? Could you
You
ask
know,
Karen?
I asked Karen Smith if she was at the summit, and she said that she was a co-presenter for some workshop. Now, does that mean she attended the entire summit? There is an agenda way back. You're on page 16. If you go to page like 62, there's an agenda that they followed at the summit. And there was a lot of presenters, and there were a lot of the issues that I'm glossing over because, like I said, medication management, not too much that we're really that interested in. But when it comes down to this, making a list of home builders and remodelers, and don't even mention OT, and they're looking for a, a safety home modification training expert, and they name one that we don't even like. And I know the guy you guys took. I didn't take it, so I think I'm being overly harsh in saying that we didn't like it. But everybody agrees that it's not as much home modification as it is, or everybody that I've heard talk about it.
It's more a marketing tool.
Not so much home modification as it is marketing, right? So does that help people decide where to put the grab bar? Probably not.
Yeah, they didn't show anything in mine about it. Hey, Louis, I'm just muting you right now because when you type, otherwise you can hear it on the speaker.
I had gotten an email from a survey company, and they said that they were hired by AARP to do a survey and reach out to people that worked in the field of like home modifications and fall prevention. So, and they would pay you to take this survey. So I contacted them, and the first question was they asked what my background was. And when I told them, they said, "Oh no, they only want people if they're interior decorators or builders." They did, and I
No,
was like, I told the woman, and I couldn't believe it, and I said, get back to AARP and say they are really doing themselves a disservice by not including occupational therapy. And then I went off and told this woman all the reasons why they need to include occupational therapists. So, I don't know what she did with that information, but I could not believe it because it was coming from AARP. And they certainly know about OT and the benefits of OT. So
that
it's
is
it's
shocking because they really have been pushing the OT thing with their whole home fit program.
yeah, I could not believe it.
Wow.
I would like to draw your attention to number 6, develop and promote standards related to product safety, service quality, skill level of home modification providers, and expected outcomes to assist consumers in making informed decisions about home safety. Who's doing that?
I want to find out who's representing OTs in this. I mean, Karen Smith might have presented, but was she on the board representing occupational
I,
therapy?
I invited her. She couldn't make it. She already had a previous
Yeah,
engagement. She couldn't make it tonight.
let's ask her.
So,
Are you going to make a list of questions to ask her?
um, I haven't been writing so far because I've been talking too much,
I'll write for
but I
you,
can make a list.
or I can call her and ask
Want
her,
a
but
question?
I'll write down any questions.
You're gonna do it?
Yeah, I can write the questions down and then I can talk to her, or you could, if you could talk to her, that'd be wonderful because you've already got a dialogue with her on this.
Well, I told her I would get back if there was questions, so
Nice.
thank you. I would appreciate it if you wrote down the questions and just email me and I'll forward them to her.
Okay.
And good. I'm glad you guys are having, because I was, ever since I found this document, I was like, well, maybe I'm just crazy. Maybe I'm just being offended because that's the kind of OT I am. I just get offended if anybody, calls me a PT when I'm really an OT. I don't like that. We're special and we do special stuff and it's important stuff. So I'm glad you agree with me.
Definitely.
Um, Strategy 2. Identify funding sources and community-based resources to assist older adults in accessing home assessments and making appropriate modifications. I really didn't like the way that was worded. Okay? There's going to be funding sources and community-based resources to assist older adults in accessing home assessments and making appropriate modifications. It sounds like to me, maybe I'm not reading it right, like they're doing it themselves.
Well, Tori Goldhammer just got I can't remember if it was $1 million or $3 million grant for Washington, D.C., where the OTs would be doing before, during, and after um, for home modifications. 1 million, Mahar says. And I wouldn't be surprised if it was some sort of a community development block grant she got.
Um, Yeah, it sounds like she has like a community they just are renovating, or maybe it's a brand new community, and they wanted it to be like universal design kind of thing.
I
Is
have,
that how you're reading it, or no?
you mean Tori's? I don't really know
Yeah.
what Tori. I don't know. Tori just said she got a grant, and I don't know
So
specific
you have no
what that is.
information about it.
I've got limited information. Just that they got this grant. They get $10,000 for home modifications per person. It's a $1 million grant. Mahar says it's the DC Office of Aging funding, and they get 3 OT visits. OT visits are getting paid up $150 a piece. The OT goes in, does standardized testing. Then they do the home mods, and then the OT goes back again and repeats the appropriate tests. And I don't know what the 3 visits are. I know those are 2 of the visits. And I don't. And she was really active in promoting and getting this grant. And maybe
Oh,
that's
of
what
course.
we all have to do too. If the money's out there, we just got to raise our hands and go after it like she did. I would like her to speak to our group. She just hasn't had the time, she said. So hopefully she'll have some time.
Oh, she's very busy right now.
Mahar
Yeah.
says initial training and post visits. But I do want to say Tori's going to be at AOTA. That's where I initially met her as well. And she's going to be presenting on all of this. Plus, um, yeah, I do have the contact information for Tori. Um, and I don't know if I should. And so anyway, I tried to get a hold of her, and I've talked to her a few times. She just said she's super busy. Louis says, from what I learned about community development block grants, it is that the state administrates the money, at least in North Carolina. A lot of the money goes to senior centers and other organizations, not as much for individual funding. Nancy, I have no idea. I was hoping she would speak to the group. She just said she's really busy. Mahar, can you tell us what you know? I think you know more than everybody else. Would you mind just letting us know what you know? Hmm. Well, we'll find out some more about Tori, but she will be
It
at
never occurred to me it
AOTA.
wasn't for actual homes. It might be for, a public place. Is that what somebody said? It might be a public place,
It was for
like a
homes.
senior center or something.
I know her grants were for homes. That's what she told me. Tori's
Oh,
last
she said
name,
actual.
yeah, she
Okay.
said homes. Her last name is Goldhammer, and she's in Washington, D.C., Tori Goldhammer. Nina says, I think CDBG, I think go to the local area and each area decides how to use it. Oh, the community block grants go to a local area and each area decides how to use it. For instance, Rebuilding Together gets some funding through community block grants. Oh, and Mahar just posted Tori's website. You know what though? We do need to know where the fund, if there's money going into this for home modifications, we should be a part of this.
Well, I mean, another thing I wanted to point out here in strategy 2, action step number 2, locate or create buyer guides and disseminate desirable home feature checklists that also include information about the cost of modifications. So again, it sounds like it's a resource. Maybe it's for professionals to help seniors. Maybe it's for the seniors themselves. But again, there's a guide, a resource that's being fabricated, and a checklist is being designed. And who's doing this? I hope it's not builders.
I don't think builders are going to do it, but they might be the ones. I don't know. People look at builders as the people who, the builders are the leaders in home mods. They just are. They just are, and that
I know.
drives me crazy.
Well, they're not the expert. And if like in your case, they didn't want to install a grab bar until you said put it here. So does that mean in 3 years, like in 2018 when they have the next summit, this action step is going to have no action because nobody wants to step up and do it?
Well, the
That's
people
not
I
fair.
was talking about were working for somebody else. Maybe some other builders who are working for themselves who, they're trying to put food on the table. They're going to put it in wherever they can. They're going to take whatever they can get. In our area, from 2006 to probably 2012, the building market was horrible. And so the builders went into home modifications for accessibility just so that they could drum up some business. And with the markets, turning back around, the building market turning back around, there's not as many people who are willing to do home modifications for accessibility.
The
I'm
jobs are too
finding.
small
What was that?
because the jobs are too small.
No, it's too specific. Why do something where they got to learn how to do it and figure out how to do it when instead they could just remodel a bathroom the same way they always have?
Yeah.
They can be more picky now. They don't need, they got money. There's people are lining up. It's hard to get a builder sometimes. So
Wow.
I'm gonna mute you right now, okay, Louie? Because I can hear
Please do. Thank you.
you. No, yeah, there you go. All right, you want to keep going, Karen?
Yeah, let's go into strategy 3. Support consumer adoption of home modifications aimed at fall preventions by featuring examples that are attractive, appropriate for home settings, easy to implement, straightforward to use, affordable, and effective. Now, the action step: engage key home improvement industry partners in developing information and products to support safe home environments and educating older adults and caregivers about home safety issues. That encompasses quite a bit, and I have questions all along the way. Who's doing this?
Yeah. Yeah, hopefully OT can step up and do this because really we should
And
be
the next,
doing this.
Yeah, the next one, expand public-private partnerships. Examples, area agencies on agings and home improvement companies to provide home assessments and home modifications with the expectation that consumers will receive discounts on products needed for home safety.
That would be nice.
Okay. Engage manufacturers and contractors in developing home features designed to reduce the risk for falls.
I would like to get a hold of, yeah. Oops, I was reading ahead.
Create public awareness campaign related to home modifications based on marketing research that can be adopted by a variety of organizations.
All right, I want to be on this committee. Who else wants to
Yeah.
join me? Let's get on the committee.
Yeah. Yeah. I mean, we should all do it.
Yeah, no, we really do need to be on this committee.
Use home improvement television Who mentioned television? Somebody was reading ahead.
Yeah.
The home television programs to feature. This is like Bob Vila.
Well, and somebody else was talking about this at a prior meeting. We should be doing some of the home improvement stuff.
Yeah.
Oh, yeah, which reminds me, I think, Nina, were you the one looking for homes of the elder, age homes for people who are older? I found the perfect house for you, and I talked to the homeowner. I'm gonna try to get you a video, hopefully this week. If not this week, then this weekend. And I just don't know how to private message on Facebook. I'm not real familiar with it, but I'll work on that. So, all right.
Okay, I guess we're done with goal A. And now goal B is healthcare. The aging network, housing, and other service providers will become more aware of and promote health safety measures, including information assessments and adaptive equipment that reduce home hazards, improve independent function, and lower the risk of falls. Sounds a lot like OT to me. And you can see right there in blue, yay, there is our Occupational Therapy Association down there. Identify and promote the use of credible communication resources for information dissemination. Well, there are three places. We're last. HomeMods.org is first. Fall Prevention Center of Excellence is second, and we're last. Well, we are in there. I meant to go to each one of those sites before today, and I apologize. But when you go to the American Occupational Therapy Association website,
Nice.
it's real hard to find this information if they even are prepared to offer it yet. I forget the gentleman. He was someplace in New Jersey, just like I am, and he does the home mod
Greg.
web thing.
Greg Frank.
Yeah, yeah. Um, I wonder if he even knows that this is in the document and that the AOTA website is going to. When I go to the AOTA, when I don't sign in, I'm a member, and you get a lot more information if you're a member. But if I pretend I'm not and I go to their website, it's hard to figure out if I'm looking for home mod stuff. It's hard to figure out how to get there. So I just go to the search bar and I type in home modification. And then a list comes up and I click on the first thing on the list and it brings me to the home modification section. So that's not real bad. But once you get there, there's nothing that makes you immediately say, oh, this is where this is where I'm going to get everything I'm looking for, or as a consumer.
Yeah, their website's so not user friendly, and I've told them that before. Not that they care
Well,
what I
in
have
this
to
case,
say, but I was just like, you can't find anything here. It's difficult.
it's hard to, yeah, as a member, you have to sit down. It's going to take a while. and you just kind of search, you just kind of forage. But if this is the public going to this site to find out for home modification questions, they should really be able to find. Well, first of all, we have two other organizations that are listed before us.
Yeah,
So if they do get to the bottom of the list and come to us, it should really like be easy enough to find.
I agree. Nancy just put the AOTA thing, the AOTA information on here.
I'm sorry?
Nancy just put a link to the AOTA practice aging resources, focus on falls prevention home mod booklet on here. But Jenny
Oh,
writes,
okay.
once you find the information, it's difficult to read, small font with poor contrast. We're OTs, we should know better. Things should
Yeah.
be user friendly.
And we're dealing with some seniors that may not be real comfortable with electronics. They may be going on just out of desperation. They're trying to solve a problem and they were told they could do it on the computer. And you don't want to make it harder for them than you need to.
No, I
It should be
agree.
kind of.
I just am wondering. Uh,
You're going to do it right now?
oh no, I'm just figuring. I wonder. So if you put it into Google, these are things that people ask quite a bit: how to prevent falls, kitchen, hospital, home, and elderly. These are some of the big things people search for. That's what, when you do this, Google tells you these are the most popular searches that are going. So it's
Well,
interesting.
this one step in particular is regarding home modification, not fall prevention, which I know it's a fine distinction, but
Well, I was just wondering if I was somebody who's falling and I wanted information,
yeah,
obviously
you're
other
right.
people are putting that on there. So, what's going to come up? Oh, nice. Mayo Clinic, CDC. Yeah, I don't know, just interested in what they had to say.
Sure.
So there's information up there. Okay. You want to keep going, Karen?
Let me see. The next one, I never considered this. It says disseminate home risk instruments and methodologies, including the use of technology for remote assessments of home environments. Can you do that?
Yeah,
Remotely assess the home environment? Is that practical? Can that work?
someone at AOTA's been doing it. They
Really?
presented and how they did it. Yeah, you have to have somebody on the other side who's technologically friendly, but to take like an iPad or something like that and scan the area with it.
So you would be consulting like to do that?
The woman that presented is charging to do that. The same thing she would charge as if she were there. And she's doing it all over the place. And
Okay.
she was being reimbursed by insurance. So I don't know everything that has to do with, but I know that telehealth or, web health, web OT is really viable.
Yeah, I pulled off an article. I know that AOTA has a position paper on telehealth, which I haven't read. I pulled it off, but I haven't read it yet. So, you know, I mean, I can't imagine doing a home environment without being in the home, but I don't know, maybe it's possible.
Yeah, who knows?
Um, Now I got lost. Strategy two.
I like this though. In strategy two, action step one, advocate Medicare and Medicaid coverage for home mod services, including the home assessment. Development
Yeah,
approaches, money follows the person. That's nice. That's good for us.
I like that too. As long as we're on the list. Yeah, I like that too. I have that highlighted myself to point out. Um, you really want it to be a benefit under managed care. And yeah, now um, down down here it gets me. I can't work with U.S. Department of Housing and Urban Development (HUD) and subsidized private housing providers to collect data on falls, conduct periodic reviews, and retrofit existing buildings. Is collecting data? Do you do that usually?
I don't, but I don't work with aging in place at all. That's
No,
not
you're just
what I'm doing.
considering it, right? Is that still looking good for you?
I missed out on what you were saying.
The aging in place thing, is that still
Oh,
looking good for
pilot,
you?
yeah. Yeah, yeah, we had a meeting and we've got some action steps we're taking. So I've got to have basically what we agreed to is my OTs would do the evaluations, the follow-up appointments. We're doing it was just we're going to start easy and just say $120 for an audit, and then functional homes or barrier-free OT is going to provide anything that has to do with accessibility, whether it's a roll under sink, grab bars, um, roll-in showers, anti-skid flooring, anything that's special to safety. My company is going to provide. So that way it'll be, and then anything else as far as the labor and just general materials, their company is going to provide. But it makes me a little nervous because I feel like we're still promoting their company, even though Barrier Free OT is going to be promoted as the OTs. In general, we're promoting their company as the home for the home modifications. And that's they could cut me out at any time. We're gonna sign a contract for a year, but after a year, anything can happen. So it does make me a little nervous, kind of letting them behind the curtain, so to speak. But we'll have to see how it goes.
So it's not going to be that you're working together as partners. That's not going to be, you're not having separate business cards printed up within partnership with kind of thing.
I'm not gonna print
Why
any.
only $120? That sounds cheap.
Well, that's for one walkthrough, but that'll work because we're gonna be using the Home for Life design app. And I talked to the people over there, and they're going to put in all of my products into that app. So when we're there, we can show the homeowner pretty home design, home modification products, like the comfort arms and the pretty grab bars and those sorts of things, and the different kinds of flooring. So that's another revenue stream, really, for me. So
Okay.
it'll be, and it's just we're just getting started. We want to just keep it simple and see where it goes and see what the need is. But it sounds like we need to get with this National Falls Prevention Action Plan people because I'm sure they're
Yeah.
working on something right now.
Yeah, well, they only gave themselves 3 years to address all of these items. So,
Well, I would like to help them address them, or all of
yeah,
us.
I mean, when my first contact with Karen Smith, she was like, "What's up? What are you curious about?" And I said, "Well, I because you went to the summit, you're the person that I want to talk to about it because if there's action steps, I'd like to participate. Oh, this is, blind without talking about it at all. I just said, if there's anything that you need somebody to help with, I'd love to help." And she was like, "Well, there's nothing to work on right now."
Yeah, I
So,
want to
and
know who the
you want
contact person is.
Hmm?
I wonder who the real contact person is because I mean, it might not be an OT, but somebody's championing this, Someone's pushing it. I want to know who that is.
Me too. Me too. There's nothing wrong with partnering with PTs and other professionals, but we can't be absent. That's
No,
a real bad idea.
I agree.
If we could go on to strategy 3, expand and enhance the delivery system for home modification and safety. The second action step there, increase collaborative partnerships among building and modeling professionals and healthcare professionals, such as, yay!
That's,
That gives you a little hope, doesn't it?
yes, it does.
So yeah, we're behind that. We just have to figure out, where the party is. And they mention us again along with physical therapy and visiting nurses when it comes to dissemination of culturally sensitive, consumer-targeted home assessment tools.
Oh.
They mentioned Meals on Wheels again for training aging service providers who routinely goes into our homes. I don't know how much they actually let you go into the homes, but I think it's a good idea to, you talk with nothing else. And they mention occupational therapists for more in-depth, individualized home safety and fall prevention assessments. So that's nice. There doesn't seem to be an action item there, but that's the direction we want to go.
Definitely.
Like,
There's been OT that's been involved in this somewhere, you can tell. We're in here enough.
yeah. Well, I'm going to say Karen Smith until I learn somebody else.
Yeah.
Just because it's the only name I know. Um, okay, and that pretty much hits. Wait a second. Once older adults have been identified as moderate to high risk of falls, develop effective referral pathways to assessing home hazards and making home modification referrals.
I like that.
Yeah, yeah, it implies like a nice kind of inner cooperative stream of work. Develop local coalitions on fall prevention that include home modification experts. And who are those?
I
Should
think
be
number
OT.
6 is kind of interesting too. It says advocate with public and private partners to support research on the development of a readiness to change tool. And that motivates adults. I mean, that's they're trying to figure out how to motivate people to make their homes safer. And that's a really interesting way to put it. Readiness to change. I mean, did you notice there's no aging in place anywhere in this document?
No, there's not. No, you're right. And the readiness to change is there's a guy who wrote about habit formation for Fraska.
Hmm.
I don't know how to say his name, but he wrote how habits, good and bad, are formed and they actually never go away. Habits are staying in your brain just in case there's an emergency and you need that particular behavior. So he has a list of steps that everybody goes through all the time whenever they make any kind of habit, good or bad, from biting your nails to taking heroin.
Wow.
Um, and yeah, they all follow the same path. There's a pre-contemplation stage where you don't care one way or the other. It's not part of your life and you don't want to know. And then there's a contemplation stage where you're thinking about it. You're aware that it exists. It might pertain to your life, and you're thinking, man, maybe I should. And it goes on like that. And it's not until step 4 or 5 where you actually do whatever it is.
Wow.
And then to be a habit, obviously, you have to repeat it.
That's interesting. Hey,
Yeah,
I think we're gonna have to wrap this up. It looks like people are getting
yeah,
ready
we're
to
getting
sign off. But it says Nancy says thank you. Margie says, thank you, Karen, for all you've done to prepare and present for the group this evening. Lots of great information. Nancy says, thank you, Karen and Karen. Lots of thank yous. Um, Ginny writes, who is this person you were speaking about for change?
Yeah, that's the one thing I don't have in my hand right now. I don't, Karen, what I can do is I'll write you an email
Okay.
and you can disseminate it with your next email list.
Okay, and yeah, and I'll write down some of the questions. I haven't done a very good job with that either. But one thing Nancy writes is, and I think she's got a good point. I'd love to find out who the leader of this coalition is and ask him to speak to our group on what we can do to help promote and help them reach their goals.
That's why I wanted to talk about this, and I'm so happy to hear that so many of you feel the same way that I do, because we really can't turn our backs on this. We'll get left out in the cold, you know.
You're right.
Uh, I'm reminded of when you had all those guests. Was it last week or the week before? Someone said, no one person can do all this. No one, it has to be a collaboration, and he's right. There's too many details when it comes to a home modification, and for just one person to be an expert on everything. But at the same time, we have to toss our hat into the ring.
Definitely. We've got a unique set of skills that
Yes,
can add to
yes.
this.
And this appears to me to be like the national driving. I mean, if you can find something else that's more central, let us know about it. But this seems to be the one place that they're really trying to pull all the efforts together. And there is big money in it. Someplace in here, there's a lot of money.
Yeah, no, there definitely is. I mean, this is something we all needed to know about. Um, by the way, Nina says, was that called The Stages of Change by Prochaska and Di Clemente?
That's it. That's the one.
Oh, that's pretty good, Nina.
You get a star, Nina. 2 stars.
Well, Karen, again, thank you for presenting this. There's a lot of interest. If you could help keep an eye on this, I think the whole group would like to follow it. And if
Oh,
anybody,
absolutely.
yeah, if anybody else has any information, or I mean, let's see if we can find who's spearheading this and get them to talk to us. Nina says, thanks, Miss Google. So you could
Does
have
that
pulled
mean
that one
for
up.
you? I think you. You're the Googler.
So anyway, let's keep an eye on this. Thank you so much, Karen. There's definitely stuff we all need to be doing with this. Um, Next Monday, we're going to have another special meeting for distributorships. That was something I'd promised to Joe that I would do, and we just haven't had time. So next week, anybody who wants to learn more about distributorships and different products, they're welcome to come. I would love to see you all. And then we'll get out the source file for the National Falls Prevention, as well as if anybody has any questions for Karen, go ahead and email them to me and I will forward them to her. Or Karen, is it okay if I put your email address?
Yeah. Karen Grund OT, no spaces, at yahoo.com.
And I'm going to put that in the follow-up email too.
That's fine.
Perfect. And then also, please think about going to AOTA. We're working on setting up a field trip, starting
Oh,
with.
my husband wanted me to ask you. He wants me to attend and go to the Frank Lloyd Wright building and then come back, and we're going to go home immediately after that.
Oh,
Is that realistic?
depends on how far you're coming from, but
Right?
yeah, you should stay a
Yeah, that's
little
what I
longer.
thought.
But what I was thinking, the Frank Lloyd Wright will be on Wednesday, it looks like, the Wednesday before.
Okay.
And then the Wednesday, there will also be, and we're trying to get all the details going on, but the bus ride to Frank Lloyd Wright will have someone presenting on home automation. We can also
Cool.
do home evaluation sorts of things. Wednesday night is it's called the AOTA SIS, the special interest groups. So that's where you'll meet a lot of other people around the nation who are doing the home mods. Those are really good. I've gone to those before. And then I'm not sure what's on the list for home mods or what's on the agenda. I know Tori's going to be there, and I know Carolyn is going to be there. They're both going to be presenting, as well as Deb Young usually presents, Marty usually presents, and then some people. Susie was there. Susie Stark was there last year too. So there's always a lot of good things going on, and I figured, we'll have to talk to the group, but the people who do show for AOTA, we can also have business work groups, at different times during the day when there aren't other home mod things going on. So plan on that. Try to make it out there. Wednesday, April 6th is the Frank Lloyd Wright home tour with the home automation. And then it goes Wednesday, April 6th to Sunday, April 10th, I think it is, or 11th. I don't know. So try to get that on your agenda. So
The whole week then. There'll always be something every day.
Yep.
Wow.
Yeah, it should be wonderful. But thank you everyone for coming. And Karen, thank you. It was a wonderful presentation.
Thank you so much.
I'm
I
excited
appreciate
to
it.
read this.
Have a good night.
You too. Have a good week, everyone. And thank you for
Thank
coming.
you.
Hey,
Thank
come
you.
next. Yeah, thank you.